Welcome to our conversation today. This is Larry Bauer, Chief Executive Officer of the Family Medicine Education Consortium, and I'm excited to be talking today with Dr. Cliff Robertson, a family physician who is Chief Executive Officer of CHI Health in Omaha, Nebraska. Dr. Robertson, thanks for joining with us today.
Well, thank you, Larry.
So perhaps by way of getting acquainted, Dr. Robertson, tell us a little about your background, where you went to residency, et cetera.
Yeah, well, I'm obviously a family physician. I actually did my undergrad at University of Colorado and then went to medical school at Ohio State. The United States Army put me through the last 3 years of medical school, so I did a family medicine residency in Tacoma, Washington at Madigan Army Medical Center.
Great. And when did you decide to become a leader or discover that you were a leader? Could you tell us a little about that?
Well, that's a tough question. I'm not sure I would even today define myself personally as a leader. I think that definition comes from others, but I've been blessed, privileged really to be offered roles, leadership roles in various organizations that have led me to where I am today, where I actually get to be the Chief Executive Officer for a $2 billion health system.
Cool. And could you talk a little about the role models that you had and the mentors you may have had who helped support you as you moved along this path?
Sure. There have been numerous people that I've had the chance to work with and work under over the last 20 years. And what I would say, although I don't know that I've ever had a formal mentor per se, my experience has been on the leadership and management side, much like it was as a resident in family medicine. Every person that I work with, there are things that you can take away from them, maybe their approaches or their style or something that you can learn from them. Sometimes it's positive. It's things that I said, I wish I could be better at that, like they are. And sometimes it's the opposite. Sometimes you see things, you see behaviors or interactions, and I've tried to incorporate the things that I don't want to do or don't want to be like into how I interact with people and how I serve or function in a role as a manager.
Cool. So could you describe your career path? So you finished your residency training, and then what happened?
Well, so my first practice experience was in Lawton, Oklahoma as an Army physician, and there my second year I was asked to take on the role of the clinic commander, using the Army language, where I was essentially the medical director for our 5-physician clinic. That I didn't know exactly what I was doing, but I was asked to do it, so I stepped into that role, and then that led to a role for the Department of Family Medicine there at Reynolds Army Hospital around quality. So I took that challenge on when it was offered to me, and then I got out of the Army and went in and joined a large medical practice in the Pacific Northwest. After a couple of years in just being a 6-day-a-week family physician, I had that opportunity to participate on a management committee for our clinic. And then the leader, the medical director for our group of 10 clinics, resigned and left the organization. And quite honestly, no one else was interested in taking on that role. And so I volunteered. That led me down another path where I had a bigger responsibility, representing at that time about 80 physicians or so, over 10 different clinic locations. And then that organization morphed, and we became a separate medical group on our own, and that was my opportunity to have a new title as the president of the Franciscan Medical Group. So Larry, mostly I would say that none of this has been planned. In fact, none of it was planned. I always expected and thought I would be a practicing physician all my life, but opportunities presented themselves to me, and I was, I guess, crazy enough or brave enough to take on challenges, even though I was learning on the job every step of the way.
And at some point, you decided to get an MBA. Could you speak to the value of that and why you decided to do that?
Yeah, sure. As I became more, as the president of the medical group, and then I became more and more involved in the health system leadership. I was a member of the leadership team. I reported to the health system CEO. It became clear to me that there was a language that was being spoken that I, as a physician, didn't know or understand. And so I made a decision, like many physicians do, to go back, and I chose an MBA as opposed to a master's in medical management or another physician-oriented approach. I chose a straight MBA just because I wanted the experience of interacting with other students, other people involved in industry outside of healthcare. What I tell folks, what I tell docs today that approach me and ask me my opinion about whether or not they should go back to school and get an MBA, and I encourage them to do it. Not so much that the concepts around management or business theory are so difficult to understand. It is truly like learning a second language, and it establishes not only credibility, but it is helpful in dealing with people that grow up on the administrative side of medicine that aren't clinicians, who have gone back and gotten masters or are CPAs or have a business experience that I, as a physician, didn't have initially. So I think for me it was the right decision, and it was quite interesting because there's lots that we could learn from other industry that would be beneficial to those of us in healthcare.
And in the current times, we're moving from the fee-for-service revenue model to a value-based model, a whole new world. Wondering if you could share your thoughts about this transition and the challenges that a system like yours is facing.
I always joke that family physicians are probably best positioned to lead healthcare into the future, particularly as we move away from this old system of paying us to do things to paying us or having our reimbursement aligned with quality and outcomes. I think all of us that have practiced medicine, particularly primary care physicians, have seen firsthand the waste and inefficiencies that exist in our system, and those waste and inefficiencies not only cost our patients, they cost all of us in terms of creating a healthcare system that's expensive to the point that none of us can really afford it anymore. So I argue and really deep down believe that primary care physicians are perfectly positioned to lead us into the future, because the model for the future is going to I think is going to look a lot different than the healthcare delivery system model that I've grown up with over the last 15 or 20 years. The challenges that we all face are figuring out how to truly be patient-centered, how to deliver better care, but also how to do it more cost-effectively. And I think the data supports that strong primary care and strong primary care leadership is going to be foundational for our ability to be successful in this new world of value.
Thank you. So how about surprises along the way? I mean, you've moved down a path that a lot of others may fear to tread, and I'm sure there's been some major obstacles and some major challenges along the way. Could you comment on things that surprised you or major learning that helped you along your path?
Well, I think there are probably two things that I personally would look back on as major learnings that are now, much easier for me to do than 20 years ago, than it was 20 years ago. I think the first thing is I don't know that physicians, by their nature or through their training, really have the opportunity to learn how to provide constructive criticism and feedback. So whether it's in a coaching, mentoring role, or whether it's a subordinate boss role, that's one of the things that I would tell you that was the hardest early on, was actually sitting down and having to go through the process of letting go. Whether it was a manager or a physician, terminating somebody's employment, or even steps before that, providing clear, concrete, constructive feedback and setting clear expectations for those that you are responsible for. I think the other learning that it wasn't something that was intuitive that I think all of us in leadership roles learn over time is there is a science behind building teams. None of us do what we do by ourselves. In fact, those successful organizations that exist, whether they're in healthcare or outside of healthcare, are generally successful because they have a strong culture and because they have a leadership team that is effective. So I always talk to folks, and particularly young physicians or young leaders, about how what I've learned over time is that while we may prefer a certain type of people, we may prefer to surround ourselves with like-minded folks who think the way we think, who believe what we believe. What you learn in a leadership position is that sometimes can set you, if you surround yourself with a lot of people like you, then you don't have the appropriate balance. You don't end up with the appropriate levels of disagreement and conflict that need to occur for an organization to make good decisions and for leaders to make good decisions. So I would say those two things were probably the biggest learnings for me and the things that I try to share with others.
Great. So one of the challenges that I've heard from physician leaders in many organizations is as you move away from the satisfaction and the excitement of caring for patients into more administrative kind of roles, the loss of that positive energy can be a real challenge. Could you comment on that?
Yeah, it's been now about 7 years since I've had any clinical responsibility, and I like most physicians, tried to keep a foot sort of in both canoes. I have a little bit of a clinical practice as I was taking on, more and more full-time roles from the administrative perspective. But for me, I got to the point of really deciding that I wasn't really maintaining a clinical activity. I wasn't doing that for patients. I was doing it out of my own, I guess, fear. We all tend to think that, that's my insurance policy. If this administrative gig doesn't work out, I can always fall back on being a doc. But I think what I tell folks, and particularly family physicians, is that organizations are like families. And one of the things that excites me every day, that motivates me every day, is that much of what we deal with in these leadership roles is not that dissimilar from what we deal with day in and day out as family physicians. We all learn as family physicians that there's always more to the story, and that sometimes the best docs, the best physicians, the best family physicians are the ones that can listen and glean information from other people's other members of the family, other people that maybe aren't just the patient. Organizations function the same way. I sit down with staff and managers across the organization and just listen to what they say, what their concerns are, what their ideas are, and quite honestly, that that makes us a better organization. It makes me a better leader because it's information that helps me see the whole much more than I would be able to, sitting in my office, interacting only with a few members of the executive team of the system. I would also tell you that organizations have personalities, and there's, with the culture within an organization is really driven by the relationships and the behaviors of the people of that organization. And so just like, just like the examples that we all have as family physicians, how, you can, your treatment recommendations can fail over and over again, and you're not, unless you understand the dynamics within the household or within the home or the relationships that exist for that patient, you may never understand why the patient, can't follow your recommendations or won't follow your recommendations, or why they can't stop smoking or can't stop drinking, or whatever the case may be. Well, organizations are similar, and that it is about the relationships of the people that make up the organization that really define, from my perspective, how successful the organization can be. And so it feels to me a lot like being in clinic and trying to solve the puzzle that every patient that brings to you on a daily basis, trying to understand what's going on with them personally and how that impacts not only what they're telling you, but how they feel and how they interact with others.
Great. Thank you very much, Dr. Robertson. I appreciate you spending time and sharing this with us. Thank you very much.
Well, thank you, Larry.
So I just stopped the recording.